Hi, thank you so much, Melissa, and welcome to everyone who's joined us on today's call. Before we jump into our content, I want to introduce you to what we called a word puzzle. You should see it on your screen now. You'll see these throughout the presentation, and it just is a nice break from the text and kind of taking a look at things in a different perspective. So if you could now use your chat and chat in what you think the current word puzzle or WUZZLE stands for. And I'll just pause now while you put your answers in. And I see many of you are getting this. Exactly. It's understanding Medicare. And that's what we're here to do today. We're going to go through some very high-level basics for the Medicare program. Specifically, let's look at our table of contents. And we're going to start with the basic definition of what is Medicare. And then we're going to take a look at the parts, Medicare Part A and Part B, how somebody goes about enrolling in Medicare, and then Medicare supplement insurance or Medigap policies. And this is what we're going to cover in day one. And if you're familiar at all with the Medicare program and taking this as a refresher, you know that there are additional pieces to the Medicare program. And so I encourage you to check out day 2 of our training, which will cover Medicare Advantage and prescription drug coverage. But let's get started now with what is Medicare. And Medicare is basically federal health insurance for 3 groups of people. And this health insurance provides coverage for over 63 million US citizens. Those 3 groups of people are those that are age 65 and older, those under age 65 with certain disabilities. And by this, we mean that Social Security has been giving recipients disability insurance for at least 24 months. So sometimes you'll hear this referred to as Social Security Disability Insurance, which is SSDI. So those who have been getting SSDI benefits for 24 months, on that 25th month, they become eligible for Medicare. Now, as you see on your screen, there are some exceptions. For example, those who've been diagnosed with ALS, or also called Lou Gehrig's disease, can get Medicare without that 24-month waiting period. They are eligible for Medicare the month after that diagnosis. And then the third group that is eligible for Medicare is at any age with end-stage renal disease, abbreviated as ESRD. And what we mean by this is that they need a regular course of dialysis or a transplant to maintain life. So for these groups of people, they're eligible for this health insurance for Medicare. And you can see the note on your screen. People who immigrate to the U.S. can also qualify for Medicare as long as they're in a lawful status, and they must have resided in the U.S. for 5 continuous years, and that without a break, the 5 continuous years right before they are applying for Medicare. Also, you can see on your screen is a great resource I want to make sure you're all aware of. It's a Medicare and You handbook, and this is updated each year. And those that opt to who have Medicare can receive it in the mail each fall, or they can go online and download it. It's sent to all newly enrolled people in Medicare as well. And it provides a lot of basic Medicare information in plain language. Also, if it's mailed to your household, it includes health and drug plans that are in your geographic area. So it's a really great resource for those who are new to Medicare, or if you're helping someone else understand the basics of Medicare. Now that you know what Medicare is, who runs Medicare? Who's responsible? And we mentioned that it was health insurance from the federal government, so it shouldn't be a surprise that there are several U.S. federal government agencies that are involved in running Medicare. The first on the left side of your screen, you see that the Social Security Administration and the Railroad Retirement Board crests are there, and that's because they handle enrollment and determining what your premium amount is going to be for Medicare. So Social Security is responsible for enrolling most people in Medicare. And then the Railroad Retirement Board enrolls those that are working for the railroad or those who have retired from the railroad into Medicare. And the reason they do this is because Social Security and the Railroad Retirement Board, or RRB, they have records of your work history, which can determine the amount that you may have to pay for your premium. So we'll go into that in detail in just a moment. But it's important to note for somebody who's new or looking to enroll in Medicare that Medicare is going to use the address that's on file with Social Security. So it's really important that if somebody needs to update their information, that they're contacting Social Security or doing so online through my Social Security account, and make sure that that information is current. And then once the enrollment and the premium determination is taken care of, CMS, the Centers for Medicare and Medicaid Services, we handle the rest of the Medicare program. So that includes oversight of Medicare contractors, program integrity activity, and policy and rulemaking. Now, sometimes you might hear people talk about the parts of Medicare, and you'll hear different letters come out as parts. And so we're going to go through that and take a closer look now. So an overview first, we have Part A, that's hospital insurance, and Part B is your medical insurance. And you can see the emblems on your screen. We'll be using those throughout. Part A and Part B are sometimes referred to as original Medicare, right? And then it skips down, skips Part C for now. And then Part D is for drug coverage, if those who are looking for help with their prescription drug costs. And so no, we did not skip Part C, but Part C is sometimes referred to as Medicare Advantage. And so we're going to be covering that, Medicare Advantage, in day 2 of our program. And really, to understand Medicare Advantage, you first have to start with the basics. You first need to know what we mean by Part A and Part B, because it does relate over to Medicare Advantage. So if you're looking for more information about Medicare Advantage or Part C or drug coverage, please look at our day 2 training for understanding Medicare. So let's take a closer look now at Part A and what's covered under Part A. So when you think of Part A, I want you to think of inpatient care, right? Part A is the part of Medicare that's going to cover you when you are admitted as an inpatient into a hospital. And you can see what is included there as an inpatient care in the hospital: the semi-private room, meals, general nursing, and those hospital services and supplies that you get while you're in an inpatient setting in a hospital. But don't confuse where you're getting your care with the determination of an inpatient, because just because you go to the hospital for your care does not mean that you have been admitted formally as an inpatient. In fact, there are 4 conditions that have to occur for Medicare Part A to cover that inpatient hospital care, right? A doctor has to make an official order which says that you need 2 or more midnights of medically necessary care to treat your illness, and you can only get that care in a hospital. So that's the hospital formally admitting you. Then the hospital has to accept Medicare, and then there's a utilization review committee of the hospital that's going to approve your care while you're there. So that's the 4 requirements that have to be true for you to be admitted as an inpatient in the hospital. And in that case, once you have that formal admission, then Medicare Part A is going to be covering, help covering those services. Now, once you've had a 3-day inpatient stay at a hospital, you might not quite be ready to go home yet. You might need an inpatient stay in a skilled nursing facility, or you see abbreviated on your screen, SNF, sometimes referred to as Sniff care. And so Medicare Part A will cover your Sniff care, after a related 3-day inpatient hospital stay. So it's important to note that skilled nursing care is different than long-term or custodial care. So skilled nursing involves rehabilitative staff and therapy staff, such as registered nurses, physical and occupational therapists. And it's the type of care that they give in specialized way to make sure that your condition is improving, right? It's different than long-term or custodial care, which is just really support with daily activity, and there's no expectation of improvement there. So Medicare Part A does cover inpatient skilled nursing facility care. It does not cover long-term or custodial care, so just be aware of that difference. And when we talk about the 3-day inpatient hospital stay, it's important to know that that is a requirement in what we'll call normal Medicare circumstances. As you know, we're in the midst of what we call public health emergency due to the COVID-19 virus. Sometimes you'll hear us refer to this as PHE, for public health emergency. And right now, to allow hospitals to have to meet their requirements for capacity, there are certain areas that will waive this 3-day prior inpatient hospital stay before Sniff care is covered. So in your notes, there is a link for the COVID-19 public health emergency waivers that can affect this 3-day rule. But it's important to note, even though it's waived now, and under normal circumstances for Medicare rules, in order for Part A to cover inpatient skilled nursing facility care, there has to be a related 3-day inpatient hospital stay before that skilled nursing facility transfer. All right, so now that you know a little bit about what Part A covers, it actually covers more than just the inpatient hospital and skilled nursing facility, but Sylvia is going to cover that later. We're going to pause here and talk about, well, what am I paying for this care, right? We know that care in a hospital can be expensive. And we're going to first start with what we call a premium, and this is a term that I'm sure you've heard in your other insurance arrangements. It's a monthly premium is a charge for having the insurance. So whether or not you're using the insurance that month, you're still going to have to pay a monthly fee in order to have access to that insurance. And what's important to know for Medicare Part A is that most people don't pay a monthly premium for Part A. And it's because they already have through the Federal Insurance Contributions Act, or FICA tax. So if you've worked in a Medicare covered job for at least 10 years, you've had this FICA tax on your payroll, or your pay stub rather, and it's going towards your Medicare Part A coverage. So as long as you or your spouse, you can qualify under your spouse's record, have worked for 10 years, then you'll get your Medicare Part A for what they call premium free. So you'll hear people talk about premium free Part A. And that's most people. In fact, about 99% of people with Medicare don't pay a premium for Part A because they've worked at least those 10 years, or Social Security counts it in quarters. So you'll hear it referred to as 40 quarters or 10 years of Medicare covered employment. And that can be you or your spouse. Now, if you're eligible for Medicare, you've met the age criteria, the other 3 groups that we had talked about at the beginning, but you haven't worked for those 10 years and you can't qualify on a spouse's record, you can still get Part A, you just have to pay for it. Okay, so there's a premium amount for Part A if you haven't had that work history. And these premium amounts change every calendar year. But for 2022, a person who wants to purchase Part A and hasn't worked those 40 quarters can get Part A for $499 per month. So that's the Part A premium in 2022. Now, there is a reduced Part A premium for those who have worked between 30 and 39 quarters of coverage. They can buy Part A for a reduced rate at $274 per month in 2022. And again, these figures are updated annually, so be sure that you're always checking on the website for the most current information. Now, if you're in that case, like that 1%, like we said, most people actually don't pay a premium for Part A, but there are a small group that does. If you do have to buy Part A, then you have to pay attention to the first that you're eligible when you're able to enroll, because if you don't enroll when you're first eligible and you have to buy it, then you can be charged what they call a late enrollment penalty, which means your monthly premium is going to go up by 10%. And that's going to be, it's going to last for twice the number of years that you could have had Part A, but you didn't sign up. So the amount is, the length rather, is going to increase the longer that you delay. So for example, if you were eligible for Part A in 2020, and you have to pay for Part A, but you didn't sign up till 2021, then you're going to pay that 10% late enrollment penalty for 2 years, right? 2 times 1, twice the number of years that you could have had Part A, but you didn't sign up. And usually, again, in those cases, if you have to buy Part A, then you most often also have to buy Part B and pay the monthly premiums for both. And we'll go into what the monthly premium for Part B is in just a minute. So that's the premium amount. You know, are there other costs associated with having Part A when you are using services? And the answer is yes, there are. In Part A, when you're admitted and you have Medicare Part A and you're admitted into the hospital, there is a deductible amount. And a deductible is essentially an amount that you have to pay out of pocket before your insurance is going to come in and cover. So for Medicare Part A in 2022, the deductible is $1,556. And that is your share of the cost when you're admitted as an inpatient and you have Medicare Part A. and that is for days 1 through 60 of each benefit period. And so we'll clarify what we mean by each benefit period on the next slide, but just keep that in mind. So you have no coinsurance, which is essentially a percentage or a set cost of the pay for days 1 through 60, but you do have that $1,556 deductible. Now, after day 60, you're in day 61 through 90 now in your hospital stay, then your co-insurance is going to come in. You're going to have a co-payment of $389 per day for days 61 through 90, again, for each benefit period. And then it goes up after day 90 for $778 per day. And then you're into what they call lifetime reserve days. And so there's up to 60 days over your lifetime. So that's what the costs are for Part A, and it's broken out for deductible and your coinsurance. And you see it changes depending on the length of your hospital stay. Now, we already talked about that after a related hospital inpatient stay that you might also need skilled nursing facility care or Sniff care. And you can see in the next line of the chart on your screen, there are also co-payments for the Sniff care. So it's $0 for the first 20 days of each day of benefit period. And then once you're there for day 21, you're going to pay $194.50 for days 21 through 100, and then all cost after day 100 in the benefit period. Home health care services, hospice care, and blood. Sylvia is going to talk more about what we mean by those services in just a moment. But your co-payment amounts are here for 2022. So it's $0 for home health care services, 20% of the Medicare approved amount for any durable medical equipment, which is actually Medicare Part B. So again, we're going to go through that. And you can see the hospice and blood amounts on your screen there. And we'll go into those in more detail. But we've kept repeating this phrase benefit period. So let's take a closer look at what we mean by benefit period and why it's so important for people with Medicare Part A to understand this concept. So we mentioned the deductible, that you'd have to pay that deductible of $1,556 per benefit period. And a benefit period refers to the way that original Medicare measures your use of hospital and skilled nursing facility services. It's going to start the first day you get admitted as an inpatient in a hospital or a skilled nursing facility or a Sniff. So the first day you're admitted as an inpatient is the start of your benefit period. And it's going to end when you haven't gotten any inpatient hospital care or skilled nursing facility care for 60 calendar days in a row. Okay, so you're paying that deductible for each benefit period. And there are no limit to the number of benefit periods you can have. So you can repeat that, and benefit periods can also span across calendar years. So if you're admitted as an inpatient in a hospital in late December, right, that starts that clock for the first day, then your benefit period is not going to end until 60 days in a row. So it's going into January and February of the following year. It doesn't reset just because it's a new calendar year. So what this is helpful in understanding is if you're admitted as an inpatient, you started that benefit period, let's say you're in the hospital for 4 days, and then they send you home, you think you're okay, but you have a complication for the same reason that you were in that hospital, and you end up getting readmitted the following week. Well, because 60 calendar days haven't passed, right? We were just talking about the following week you had to go back for the same care. You don't have to pay another deductible because you're still within that benefit period, right? Conversely, if you were admitted into a hospital and you were there for 4 days and they sent you home, and then 2.5 months later, you have to go back into the hospital. Now you're probably beyond that 60-day calendar days in a row, and now you would have to pay the $1,556 deductible again because you started a new benefit period. Another important concept when it comes to Part A costs is the inpatient or outpatient determination, which is sometimes called the 2 midnight rule. And we talked about defining Part A as really focusing on your inpatient status. The doctor has formally admitted you as an inpatient and not necessarily just where you're receiving care. But this can be confusing to people sometimes because they might go to the emergency room and they might be taken in by the hospital and be given a room in the emergency room, and they're under what they call observation care, right? Somebody might think that they're an inpatient, but that hasn't happened yet. You're still in the emergency department. You're still under what they call observation care, and your doctor has not admitted you formally as an inpatient yet. Well, in that circumstance, because Part A only covers inpatient care, Part A is not covering that time in observation care, right? So if you don't have Part B or another source of insurance and you only have Part A, then all of that cost is going to be out of pocket. So it's important for somebody with Medicare to understand their status as an inpatient or outpatient and understand what part of that bill might be their responsibility for out of pocket versus what part Medicare Part A or another insurance might cover. And it's so important that people need to understand this, that there's actually a requirement for a hospital to provide you with what they call a MOON, or Medicare Outpatient Observation Notice. So this is in writing. The hospital has to notify somebody if they're in observation status for longer than 24 hours, but before the 36th hour. Okay, so it's got to be a notice just letting the person know that, yes, you've been in the hospital for almost 24 hours, so 2 days now, but nobody's formally admitted you yet, right? The doctor hasn't certified that you need at least 2 midnights of care, even though you've been in the emergency department under observation care for that amount of time. Now, when the doctor is, say, if you're in the emergency department and you're under observation care for that 24 hours, and they've given you the MOON notice, and now your doctor is looking at, your health history and the records and what's going on medically, your doctor can make that determination that, yes, they need to be admitted as an inpatient and writes the formal order. Now you're admitted as an inpatient. What Medicare Part A will do is they'll actually retroactively cover the services that you're provided as under observation care for up to 3 days prior to that formal hospital admission by your doctor. Okay, so once you're admitted, even though you're under observation care for that 24 hours before, that inpatient admission is going to allow Medicare Part A to cover up to 3 days prior because your doctor formally admitted you as inpatient. So it covers this, but what it does not do for retroactive, we talked about the 3-day requirement for skilled nursing facility care. Unfortunately, that is not retroactive for Medicare Part A. So it does work for observation care in terms of the cost, as long as you're formally admitted eventually by your provider, and goes back and covers up to 3 days. And so I know that can get a bit confusing. So let's take a look at the example on the next page and see if that helps work through that concept. So here's our Check Your Knowledge, and you can use the chat to respond to your thoughts. Alex went into the emergency department at his local hospital, and he was there for 3 days before the doctor wrote an order to admit him as an inpatient. He was in the hospital for 2 more days. How many days total were covered by Medicare Part A? I'm going to start the countdown timer, so go ahead and get your thoughts together on that. We just went through and discussed what Medicare Part A does and what it might be retroactive with and what it might not. Great. I'm seeing your answers come in the chat here. And most of you are getting this. It is a bit confusing because it works one way for observation coverage and then different for skilled nursing facility cover, but 5 days is the correct answer. So his Medicare Part A coverage is going to be retroactive up to 3 calendar days, because in this situation, we said that he was there for 3 days before a doctor wrote an order to admit him as an inpatient, and then he was there for 2 more days after. So the 3 plus 2, Medicare Part A is covering that total of 5 days. All right, and with that, I'm going to turn it over to my colleague, Sylvia Gary, for home health care coverage. Sylvia?
All right, thanks so much, Kim. All right, let's take a deep dive here into the home health care coverage. As you can see on the slide here, it really does cover skilled nursing care. So it's not necessarily care with homemaker services or checking on you at home. It's really offering you some sort of physical therapy, speech language therapy, continued occupational therapy. It's not, again, a delivery service for meals. It's not 24-hour care because Medicare does not pay for custodial care. So again, there is some medical social services that are available, including home health aid services, supplies for use at your home, durable medical equipment if you needed it for home health care coverage, or if you needed some injectable osteoporosis medications, Medicare will cover that under the home health care benefit. But again, what you want to consider is that, again, you need to have some sort of skilled need in order to get some sort of home health care coverage. And typically the home health care agency will coordinate that all with the doctor's care. Now let's look at the next slide here and learn more about the requirements to have home health care coverage. So there are 5 key requirements needed for home health care coverage. You must be homebound. So what that means really is that the doctor is certifying you that you have trouble leaving your home without any help, like a cane or a wheelchair, or because of illness or injury, it's really hard for you to leave your home and it's not recommended. If you're normally unable to leave your home, but you still requires you a major effort to leave, that considers you homebound. That doesn't mean that you can never leave your home. It just means that it's very taxing for you to get some kind of services if I have to leave my home. You must need some sort of skilled nursing care, meaning you need some kind of physical therapy, speech language therapy, occupational therapy, or a skilled nursing service. And it must be under the care of a doctor. And what that means is the doctor will set a plan of care, which establishes how many days a week, how many hours. They set what sort of treatment plan you're going to have under the home health care coverage. Not the home health agency, it's the doctor's plan of care that will go ahead and set that up. And then we'll review it regularly to make sure that there's some sort of progress or if they need to make any adjustments to the schedule that they've set up. You must have a face-to-face encounter with the doctor, meaning that the doctor will look at you, talk to you, decide how we're going to set up this plan of care for you, all within the first 30 days of being in home health care coverage. And again, they'll go ahead and review that if a need be. Typically, the encounter timeframes include within 90 days prior or within 30 days after the start of care. And there are some telehealth benefits that offer some flexibility for patients to go ahead and meet with their doctor that way versus face-to-face. And lastly, the services must be in a Medicare-approved home health care agency. So again, it's not, you don't want to just pick a home health care agency because your niece works there or it's down the street from your house. You want to make sure that it's at least going to be coordinated with your Medicare plan to go ahead and be paid for it, whether you have Medicare or if you're looking at a managed care plan. We know that you want to make sure that you get services that are going to be approved by the plan or by Medicare in general. Now, I just want to point out here that Medicare Part B does pay for some home health care conditions, but we're looking at Medicare Part A coverage right now, but in some instances, Medicare will pay if an inpatient hospital stay does not precede the need of home health care or when the number of Part A covered home health care visits exceeds 100. This is a shared benefit with both Medicare A and B. All right, now let's look and see how we pay for this kind of coverage. Under the original Medicare model, so the fee-for-service option, you will pay nothing for any kind of home health care services. So it's a great benefit, but you will have to pay 20% of Medicare approved amount. So again, that 80-20 split where Medicare pays 80% and you pay 20% if you require some sort of durable medical equipment. So again, if you require some kind of wheelchair or walker, again, that's going to go ahead and be covered by Medicare, but you'll have to pay some sort of Medicare approved amount. And typically that's going to be covered by Medicare Part B. Now, Medicare also will pay your home health care agency a one-time payment for covered services that you get during a 60-day period. Again, this plan of care is also known as an episode of care, and that payment is based on your condition and your care needs. And again, it's going to be reviewed as well. Now, to learn more about where you can find a home health care agency and to be a part of this benefit and to work with your doctor, you can always visit the Medicare website at medicare.gov and look at the Care Compare and look to see what home health care agencies are contracted with Medicare and that take Medicare assignment. All right, let's look at the next slide here. Under this scenario, you've got some time to kind of look at this, and we'll evaluate the answer in a minute. But Edgar is getting Medicare covered home health care. On Monday, his daughter took him to a doctor's appointment. On Sunday, she took him to church. On Wednesday and Friday, he's picked up for an adult daycare. As long as he meets the other requirements to get home health care, he still qualifies for home health care coverage, even though he was able to leave his home. True or false? You've got about 15 seconds to go ahead and kind of gather your answers here and what you think it might be. Well, the answer is true. And the reason why is even though you are leaving your home and you're homebound, doesn't mean that you can't ever leave your home. So again, he went to the doctor's office, he went to church, he went to adult daycare. It's taxing him for him to leave his home. So again, he is allowed short or infrequent absences for non-medical reasons. So again, it's not going to impact his home health care benefit. All right, let's move on here. Now let's look at hospice coverage. Under Medicare Part A, of course, hospice coverage is going to be offered, and it's a great benefit for those who are terminally ill and their families. And usually it's at home or a facility that you live in. So again, this hospice coverage is for somebody whose life expectancy is less than 6 months. It focuses really on palliative care. So we're looking at the comfort and pain relief. It's not a curative measure. And sometimes we see people with Medicare come on and off of the hospice program, depending on their treatment regimen that they have with their doctor. But you will sign an election statement saying, I choose the hospice care instead of routine Medicare covered benefits to treat your medical terminal illness. So how that works is when you sign that form, then the doctor will certify that you are terminally ill and probably will have less than 6 months to live. The care is given in election periods. There's 2 90-day election periods. And then after that, there's unlimited 60-day periods. At the start of each election period, your doctor must certify that you are terminally ill and for you and to continue on the hospice care program. Now, to work with a hospice provider or a hospice agency, you want to make sure that they are Medicare approved. In the hospice agency, you can learn about more under the hospice benefits under Medicare.gov. We have a special publication that's available. But again, the focus here is really going to be on physical, social, emotional, and spiritual needs. Some hospice agencies offer special therapies like music therapy or art therapy as a way of coping. So again, the hospice benefit is designed to focus on and allow the families and the patient to kind of work on the last days of their lives. Let's look at the next slide here because we'll look at how you pay for this and other services that are included. Okay, so again, physician and nursing services are going to be included. If you need continuous therapy for physical, occupational, speech, language, that's going to be covered under the hospice benefit. Your medical equipment and supplies, again, that's going to be covered. Now look here, drugs for symptom control and pain relief. Now, if the person with Medicare takes other medications outside of symptom control and pain relief, hospice will not cover those medications. That would be your separate prescription drug plan, that Part D plan that you might have, or other drug coverage that you may have. They will cover those medications. But if you're requiring symptom control and pain relief medications, that's covered under the hospice benefit. Short-term hospital inpatient care for pain and symptom management. Again, will allow you to go into facility if you're requiring some sort of pain relief or symptom management. That's going to be covered. Skilled nursing facility care coverage if required. Now, for families, we also offer respite care for those persons with Medicare who need to go into a Medicare certified facility. They're allowed to go up to 5 days each time. There is not a limit on the number of times they can go in and out of the facility. So let me just give you a little insight into that. So you can go into the facility Sometimes I've seen some scenarios where somebody will go into the respite facility for up to 5 days because the family member is traveling, and this is an opportunity for them to get some kind of care without being in the home setting. And then they, once they return back from their trip, they can come back and that person with Medicare can go back home. Hospice aid and homemaker services are included. So again, I'd mentioned before under home health care coverage, we do not allow for homemaker services, but under the hospice program, there is some hospice aid and homemaker services that are going to be available, social service needs, as well as grief, dietary, and other counseling options that are also going to be covered as well. Let's look at the next slide here and see what you're going to be paying for these services. Under the hospice benefit, under original Medicare, you pay nothing for that sort of service. Again, if you have medications that are focused on pain management and symptom control, again, the hospice program will pay up to $5 for Medicare approved payment amount for those inpatient respite care. And those medications, they'll pay $5 for each prescription drug for those symptom controls and pain reliefs. Now, respite coverage, 5% of the inpatient stay. So what that means, I'm sorry, I jumped ahead, is that, for example, if Medicare has approved the charge of $150 for your stay in an inpatient respite care, you will pay $7.50 per day. Because again, you are paying 5% for that inpatient respite care. Now, the amount you pay for respite care can change every year. In bold here, as you can see on the slide, says room and board may be covered in certain cases. So in short-term respite care for pain management, symptom control that can't be managed at home, or if you have Medicaid and you live in a nursing facility, room and board may only be payable in certain circumstances. Now, again, to learn more about hospice program or to learn more about where you can get a hospice agency near you, you can always visit the Medicare website, or you can always contact 1-800-MEDICARE as well. Now let's look at the next slide here. Okay, we've got another Medicare word puzzle, so let's put our thinking caps on and look here at this example here. What do we think this is? Well, as everybody's typed in their answer, we can go ahead and solve the puzzle as Medicare word puzzle is going to be inpatient. How clever is that? Now let's look at the next puzzle. Oh, I like this one. Let's go ahead and type in our answers here. All right, benefit period. Fantastic. And our next puzzle. This was really a head scratcher for me. I had to really think about this one. All right, it's going to be deductible. All right, now let's go ahead and hand this over to Kim. And you can go ahead.
Thank you so much. Thank you, Sylvia. So Sylvia just finished up on our Part A benefits and services and costs. And so now we're going to move into the other half of what's sometimes called original Medicare, so Part B, which is also referred to as medical insurance. And so Part A covered inpatient care. For Part B, I want you to think outpatient, right? This is when you're going to your doctor's office to get doctor services or other outpatient visits such as outpatient surgery or supplies, things like x-rays or stitches. Anytime you need to go to a laboratory and get blood tests or urinalysis and screenings. DME, durable medical equipment. I know that Sylvia had just alluded to that, that things like walkers and wheelchairs that are sometimes needed for home health care. Diabetic testing equipment and supplies. These are things like testing monitors, your blood sugar test strips, the Lancet devices, all those supplies to manage diabetes is covered under Medicare Part B. There's also a lot of services called preventive services, and these are things like flu shots and a yearly wellness visit. That's covered under Medicare Part B. Home health services, I know Sylvia had just mentioned that can be a dual benefit, right, under Part A and Part B because it was covered and included under Part A slides. If you have Part A covered home health care, that's that 100 visit limit. And so sometimes Part B can pay for home health care if you have both, and it either doesn't precede the need, a hospital stay hasn't preceded the need for home health care, or if you had Part A covered and you've exceeded that 100 visits. And then medically necessary outpatient physical and occupational therapy, that includes speech language pathology, and outpatient mental health care services. And so Part B covers a lot. This is a long list. It's not even comprehensive. If you want to find out if Medicare covers a particular service, and really that includes Part A, want to make sure that you're aware that medicare.gov/coverage, the link is in your note. You can always visit that and type in a service or supply and see if it's covered under Medicare. You can also cover, call 1-800-MEDICARE. And there is actually an app called What's Covered that you can download for free on the App Store or Google Play. That will let you know what services are covered under Medicare. Let's take another break here and do some wuzzles or word puzzles. And we had just briefly mentioned this. So go ahead and chat in your thoughts. A lot of people are working out, right? They're being very physical, right? So this one is physical therapy. And we just mentioned that outpatient physical therapy can be covered under Part B. Here's another one. Go ahead and type in your thoughts for this one. Right, you're getting this one. This one's pretty easy. This one's colonoscopy. And this is also covered under Part B. This is actually one of the preventive service benefits that's covered under Part B. Now, this one always kind of makes me think twice. But take a look at not only what the image is, but what the image is doing, right? That's right. I see you guys are getting it now. Sniff, right? SNF, this dog is sniffing. And we talked about the skilled nursing facility. That's the abbreviation you'll hear a lot of times for skilled nursing facility care. And that really, if inpatient care, it can be covered under Part A in a SNF. But if you're going to a skilled nursing facility on an outpatient basis, maybe for things like rehab services, that outpatient determination could cover that under Part B. Okay, so now that you know a little bit of the services that are covered under Part B, let's talk about cost. So unlike Part A, which we said that most people don't pay a premium, Part B is the opposite, where just about everybody pays a premium. And the standard premium is $170.10, and that's for this year, 2022. Again, this amount changes yearly. So most people pay the standard Part B premium. However, you could pay more depending on your income. So we'll talk about that on the next slide, but you also might pay more if you have a late enrollment penalty, meaning if you don't sign up for Part B when you're first eligible, your premium amount could go higher because you didn't sign up on time, what they call on time, and it would go up 10% for each 12-month period that you could have had Part B but didn't take it. And unlike the Part A we talked about for people that have to pay for Part A, there was a late enrollment penalty. That one only lasts 2 times the number of years that you could have had Part A but didn't. Unlike Part A, the Part B penalty, once you have it as long as you have Part B. So sometimes you'll hear people talk about this lifetime penalty, and that's what they mean. So it's really important to know when you're first eligible for Medicare and know the enrollment periods. And we'll go into those later on today as well to make sure that you're signing up when you're first eligible so that you're not looking at this increased premium amount that's called the late enrollment penalty. And also you can see there kind of in the middle of your slide that there are a small group of people that will pay a little bit less than the standard Part B rate. And this is due to a Social Security standard, which is called the hold harmless provision. And it limits the increase in the Part B premium to be no greater than the increase in your Social Security benefits. So there are some people that fall into this category, but like we said, for this year, most people would pay the standard Part B premium amount or more. And this is what I alluded to earlier, that if your income is higher, that you might be paying a higher premium rate for your Part B. And this is sometimes called IRMA, which stands for Income Related Monthly Adjustment Amount. And again, this is updated every calendar year. So this is the chart for 2022, but the amounts are actually determined based off of the last full record that the IRS has from your tax return, which means it's based off of your 2020 tax return. So every year your IRMA chart is updated, but it's based on the tax return from 2 years prior. Okay, so just follow along on the rows with me. So you see the rows going down are income levels as reported on your tax return from 2 years ago. Okay, and then the columns are depending on how you filed that tax return. You have the first column, which is if you filed as an individual. The second column is if you filed a joint tax return. And then the third is that you're married, but you filed a separate tax return. And then that last column on the end is going to be what you're paying for your Part B premium, right? So that first line, if you filed individually and you made $91,000 or less, then you're going to be paying the standard Part B premium, which is $170.10. Now, if you made more than $91,000, right, so move down to that second row that's shaded in white. So if you made above $91,000 up to $114,000 in 2020, and that was reported on your tax return, then now you're going to be paying $238.10 for your monthly Part B premium. Right, so you can see how that chart follows along. And this would not include, right, if you signed up for Part B later after you were eligible and at least 12 months passed, then you would also have a late enrollment penalty. So you can see how the amounts can certainly add up. Now, if you've had a life change, so we mentioned they're basing this off of the tax returns from 2 years ago. If you had something that's changed that affects your income and you don't think that you should qualify or you no longer qualify for this IRMA amount, then you can also contact Social Security and ask for them to reevaluate your income-related monthly adjustment amount. So you could call Social Security at 1-800-772-1213. For example, maybe you were divorced and now your 2020 tax return reflects the joint income, but now that's no longer the case, right? You're on an individual income. So you can provide that information, the paperwork, and an explanation to Social Security and ask that they redetermine or reevaluate your IRMA amount for Medicare Part B. In the meantime, while they're looking through that paperwork, you're going to want to keep paying your monthly premium amount because you certainly don't want to lose your coverage, but they can evaluate and make a different determination based off of what you submitted. Now, what about a copay or deductible, right? There are additional costs other than just the premium for Part B. This is a yearly deductible amount. So remember, we said the deductible is the part that you pay before your insurance kicks in. And for Medicare Part B, it's $233 even for calendar year 2022. And unlike Part A, which we said that deductible was per benefit period, for Part B, that deductible is yearly, right? So you're going to pay the first $233 of your Medicare Part B services, and then your Part B coverage is going to kick in, right? Doesn't matter. There's no benefit period or counting for 60 days. After you've met that deductible, when you go to your doctor's office or you get Part B covered services, in general, that's where that 80-20 split that Sylvia referred to earlier is going to come into account, where Medicare Part B is generally going to pay 80% of your doctor bill, and then you're going to have a 20% copay. Now you see the second bullet there. A lot of the preventive services, because Medicare wants to keep you healthy, are actually offered for zero cost. And then there's a 20% coinsurance for the outpatient mental health services and the copayments for outpatient hospital services as well. Right. And it's important when you're seeing your doctor's offices and picking your providers and you have Medicare Part B, that this 20% for most covered services is for providers that accept what we call assignment. An assignment is an agreement by your doctor, provider, or supplier to be paid directly by Medicare, that they are going to accept that Medicare payment amount as payment in full, and they're not going to bill you for any more, as long as you met that Medicare deductible. So it's important when selecting providers that you're going to want to make sure that you're seeing providers that accept assignment, because that will help ensure that you're paying the lowest cost possible out of pocket for Medicare Part B covered services. All right, so with those costs, there are other things to think about when people are considering whether or not to sign up for Medicare Part B. And we want to kind of highlight some of those things, that most people are going to pay that monthly premium for Part B, right? The $170.10 is what it is for 2022, but it could be more depending on your income. You can pay it, and it's usually deducted right from your Social Security or Railroad Retirement Board benefits. It is, again, going to adjust based off your income from 2 years ago. If it's not taken right from your Social Security check, you can actually issue your bill payment by credit card, check, or money order, and there's more information about that on Medicare.gov. Now, you might have another form of insurance, right? You might have employer coverage or union coverage, and you have to make sure that you consider that when you're deciding whether or not to get Medicare Part B, right? Because it might duplicate coverage. On the other hand, it might supplement coverage, right? They might work together, and one will pay the first part of the bill, and then the other would pay their share, and that would leave you with very little to no out-of-pocket costs. So it's important to consider what other coverage you might have available. But there are certain circumstances where you have to get Part B. Let's take a look at those. So if you want to buy a Medigap policy, right, and we're going to go into that, what we mean by Medigap policies and what they cover later on today, but you need to have both Part A and Part B if you want to have Medigap. If you want to join a Medicare Advantage plan, this is sometimes called Part C, and this is going to be covered in day 2. But again, if you want to have that option, then you have to have both Part A and Part B. Now, if you're eligible for TRICARE for Life or the Civilian Health Medical Program of the Department of Veterans Affairs, so you see the abbreviation, sometimes CHAMP VA, then you have to get Part B. So TRICARE for Life provides expanded medical coverage to Medicare eligible uniform services retirees that are 65 or older. So the difference here that's important to keep in mind is whether it's an active duty service member or a retired service member. So if you're active duty and you're covered under TRICARE, then you are not required, I repeat, not required to get Part B. But if you are a retired service member and you have TRICARE for Life, then you are required to get Part B in order to keep your TRICARE for Life coverage, okay? Sometimes if you work for a small employer, and what do we mean by small? We mean less than 20 employees, then your employer can require you to get Medicare Part B when you're eligible for it. So just make sure that you're talking to your employer rep or benefits administrator so that you know the rules as you approach Medicare age. And you can see there's an important note at the bottom of your screen that there are also Veterans Affairs benefits, and they are entirely separate from Medicare, meaning they don't coordinate. Those two programs don't talk to one another. You can get VA benefits, and you can choose to enroll or not enroll in Part B. But when you get a service, you have to pick which program you're going to use, right? Whether you're going to use your VA benefits. And if you choose not to enroll in Medicare Part B and just continue using your VA benefits, that's okay. But if you change your mind later and want to get Medicare Part B, you would be looking at that possible late enrollment penalty, because there's not a special enrollment period just because you are covered under the VA program. Right, and we talked about a lot of these costs, per the deductible, the copays, and you can see that there are a lot of out-of-pocket costs, and it's important to know that for people with limited income and resources, that there are programs that can help pay for some of these costs. So you'll hear these referred to as Medicare savings programs, and this is a little bit different than what we call full Medicaid, right? Medicaid is a separate health insurance program, help for people with limited income and resources. But these guidelines are going to be less restrictive, meaning there's a higher income and resource guidelines than a full Medicaid program. So if you look at each of the programs, right, the Qualified Medicare Beneficiary Program can help somebody with their Part A and Part B premiums deductible and coinsurance and co-payments amount. And then it also allows for Part B premiums only, meaning, and no balance billings, meaning that the provider can't come back and bill you for a remainder of the cost, right? So that's one of the more generous programs. So it has a lower income and resource limit. And the specific limits, we do have cost information in the notes pages of your slides that you can go through. And they are updated every year. We refer to federal limits, but you should always check with your state. And if you think you might apply, we encourage you to try, because states calculate your income and resources differently. So you might qualify in your state even if your resources are higher than what you're seeing as the federal minimum amount. So if you're close, we encourage you to contact your state medical assistance office and find out which program might be available to you and apply. So moving down, the second row is specified low-income Medicare beneficiary, or sometimes you'll hear this called SWMB, right? That's going to help pay for that Part B premium. We talked about that, $170.10. Qualifying individual, this is a first-come, first-served basis. So there's a certain cap. So the sooner you apply, right, if you qualify, then you can be granted this assistance for a qualifying individual, but there's a limit. So it's best if you think you might qualify to apply early. And then the last group is the qualified disabled and working individual group. And this is going to help those that have a disability and are working, right? So this helps pay Part A premiums only. And again, it's determined by income and resource levels, and the income amounts are updated annually with the release of the federal poverty level. All right, and now I think Sylvia is going to take us through an activity to test between Part A and Part B.
That's right, Kim. All right, as you can see here on the slide, we've got two little images here. One is the Part A hospital-based coverage, and Medicare Part B, the medical insurance, and it's denoted by either a hospital picture or a stethoscope. So let's go ahead and dive into this little activity and help us identify what is covered by Part A or Part B. All right, the first one coming up is are we going to move on? Okay, thank you. Okay, medically necessary doctor's care. What do we think that is? Is that Medicare Part A or Medicare Part B? You can go ahead and type your answers into the chat, and we'll see what the answer is in just a few seconds. Look at here at the clue, doctor's care. Yep, that's right. Medicare Part B, medical insurance. Okay. Medically necessary inpatient hospital stay. Is that Medicare Part A or Medicare Part B? Okay, that's right. Medicare Part A, your hospital-based coverage. Okay, let's look at the next one. Colonoscopy. Is this Part A or Part B? That's right. It's Medicare Part B medical insurance because it is preventive service. Colonoscopy is considered a Part B benefit, even though it might be in a hospital setting. It is a Part B covered benefit. Okay. Routine eye exams. Is that Medicare Part A or Part B? This is a tricky one because it's not covered by original Medicare. Routine eye exams aren't covered by original Medicare. We don't cover everything. For instance, Medicare doesn't pay for routine dental services, hearing aids, or cosmetic surgeries. But a Medicare Advantage plan or Medicaid, they may offer things that other services that Medicare does not offer. So if you're looking into a Medicare Advantage plan, the managed care option, they might have medical eye care coverage or routine dental care or hearing aids that they may cover. But again, original Medicare does not cover routine eye exams. Home health care. Kim and I both went into home health care. This could be a shared benefit. It could be either Medicare Part A and or Medicare Part B. It just depends on the circumstances. Generally, Medicare Part A will cover your home health care. However, Part B may also cover home health care if the inpatient hospital stay doesn't precede the need for home health care, or if the number of Medicare Part A covered home health visits exceeds 100, then Medicare Part B will cover it. So again, it's kind of a tricky question here. It could be all of Part A, or it could be Part A or Part B. Okay, we're going to see a video really quickly here on the appeal process. When we think about Medicare appeals, there is a 5-level of appeal process. And this video will help us identify which level and how you move on to the next one. So let's see the video here.
Have you ever gotten a statement from Medicare or your health plan and something wasn't covered but you thought it should have been? Or maybe Medicare or your plan didn't pay the amount that you thought it should? If so, you may be able to file an appeal. An appeal is the action that you can take if you disagree with a coverage or payment decision that's made by Medicare. And no matter how you get your Medicare coverage, you always have the right to appeal. You have the right to appeal if your Medicare or your plan denies any one of these things: a request for a healthcare service, supply, or item or prescription drug that you think you should be able to get, or a request for the payment of a healthcare service, supply, item, or prescription drug that you already got. You can also appeal a request to change the amount that you must pay for a healthcare service, supply, item, or prescription drug. And you can appeal if Medicare or your plan stops providing or paying for all or part of a healthcare service, supply, item, or prescription drug that you think you still need. There's a process when you want to file an appeal, and it has 5 levels. At each level in the process, you'll get a decision. And if you disagree with the decision made at any level in the process, you can generally go to the next level by following the instructions that you get in the decision letter.
All right, let's look at Medicare enrollment. How and when can you enroll into the Medicare program? Okay, well, this is pretty interesting. It all varies on whether or not you are already getting Social Security disability insurance, that's SSDI, Social Security retirement benefits, or the Railroad Retirement Board. If that's the case, then typically the Medicare enrollment will be pretty much automatic for those individuals. But however, depending on other circumstances like under 65 or the age of 65 could vary on whether or not you need to make some kind of action on your part to enroll into the Medicare program. And really, it's going to be also looking at the other coverage you might have, either where you're actively employed or if you're about to retire. We'll look at what are the best options of you, whether you enroll now or later. Okay. This is why enrolling on time is very important. If people with Medicare do not enroll on time, then they could face a higher premium amount for Medicare Part B. And there are some late enrollment penalties if you do not have other coverage. Or they could pay more for their Medicare supplemental insurance policy, Medigap policies. Now, under Medicare Part A, late enrollment penalty, it lasts 2 times the number of years a person with Medicare could have had Medicare Part A but did not. And as for Medicare Part B, the medical insurance and prescription drug coverage under Medicare Part D, that late enrollment penalty can last a lifetime. So really what we're encouraging you is if you need to enroll into Medicare and you're worried about penalties, really be cognizant of the time frame as well. Now, coverage can be affected like having a gap in the coverage, or if you have a waiting period for any pre-existing conditions for a Medigap or Medicare supplemental insurance policy. Again, the timing is going to be key here. And you may have to pay more for your Medigap policy, or you may not be able to buy a Medigap policy looking at the enrollment timeframes. Now let's look at who's automatically enrolled into the Medicare program. Okay, if I'm already receiving Social Security benefits, or if I get railroad retirement benefits, I know I will automatically enroll into Medicare because they know you're eligible and you'll receive a welcome to Medicare package in the mail. It's mailed 3 months prior to the age of 65 or the 25th month of your disability benefits, okay? Now, it will include your Medicare card, and then you'll also get this little pamphlet that talks about, your decisions that you need to make under getting your Medicare coverage. Now, if you're under 65 and you have a disability, again, we know you automatically qualify for Medicare A and B after you get your notice. The same if you have Railroad Retirement Board, they'll let you know when it happens. Now, if your birthday is on the first day of the month, okay, and your coverage begins the first day of the month prior to the month that you turn 65. Now, if you're not getting any railroad retirement benefits, Social Security, then you need to go ahead and enroll into Medicare directly. And as you can see on this image, there is a important decisions about Medicare that goes into that, and it kind of explains to you the different options you have under the Medicare program. Now let's look at the Medicare card. Okay. Now, if you have original Medicare, which means you've opted for the fee-for-service option, this is your card to Medicare, this red, white, and blue card. Again, if you join a Medicare Advantage plan, the managed care option, then your plan will give you a card to use to get any kind of services or supplies through that plan. And you will have to show that Medicare Advantage plan ID as well if you're going to be asked to show any kind of information for services under the managed care plan. Now, the red, white, and blue card here that you see will show the dates for Medicare Part A enrollment and Medicare Part B enrollment. Sometimes you have two different dates on there, depending on when you choose to enroll into that. And the unique ID here on the Medicare number, it's unique to you. It's a combination of letters and numbers. In years past, we used to use your Social Security number or somebody's Social Security number that you may have called, you may have gotten your information from, like a spouse, if you're drawing on their Medicare record. But now all this has changed to really protect that person with Medicare. Now, when you receive the Medicare card in the mail, you can either keep it and accept Medicare Part B with that enrollment date, or you can refuse Medicare Part B and follow the instructions on the Welcome to Medicare package. And then they will mail you back a brand new Medicare card with just the Medicare Part A entitlement date. Now, you carry this card when you're away from home. You can let your doctor and see it. If you need a replacement card, those are always easy to get through Medicare.gov, or you can always call 1-800-MEDICARE. But again, since this number now is not tied to a Social Security number or any information like that, it's been really protected to help Medicare beneficiaries and their families as well. Now, let's look at the next slide as we talk about what you need to do to enroll into Medicare. Okay. Now, if you're not automatically enrolled into the Medicare program, then you need to go ahead and enroll through Social Security. You can either do it through the Social Security website, or you can always call their 1-800 number as well and follow the steps to get enrolled into the Medicare program. That's for either Medicare Part A and Part B. Anybody who's with the Railroad Retirement Board, they need to contact them directly to get their benefits. Now, I want to note that the full age of Social Security retirement benefits is increasing, but Medicare entitlement age for eligibility is still age 65. Now, when you get the Welcome to Medicare package, it's sent to those who actively enrolled to Medicare A and B. It's mailed about 2 to 3 weeks before they apply. After they apply. And in that, you'll not only get your card, but also explain to you some things about the key dates to look at, a cover letter and a pamphlet to also talk about other decisions that you need to make. You can also visit information on enrollment through socialsecurity.gov as well to learn about the next steps that could be involved in enrolling to the Medicare program. You used to have to go into the office and enroll into Medicare, but now they've made it a little seamless by going through the website or contacting 1-800 number 772-1213 through Social Security. Now let's look at this next word puzzle here. I've been talking quite a bit about this one, so let's see if you kind of get the answer here. Okay. It's the Railroad Retirement Board. It's kind of clever how they did that, isn't it? All right. Oh, wow, I like this Medicare puzzle. It's this cute one. All right, what do you think that is? Make sure you type your answer in. Okay, it's automatic enrollment. You see the car, automatic, and then the roll for the carpet, enrollment. Okay, all right, Kim. I'll hand it over to you.
Thanks, Sylvia. So Sylvia just talked about, some people are automatically enrolled, some people have to sign up. We're going to go into, okay, if I have to sign up, when can I do it? You can't just pick any time of the year. There are certain periods, which we call enrollment periods, that are set aside for people to get Medicare or also to make changes if you're already in Medicare. So you see on your slide, we have them grouped separately. So the first bullet point, and there's 3 sub-bullets there, are, and we'll go into these individually in just a moment, but if you don't already have Medicare, right, you need to sign up for the first time. So there's 3 different enrollment periods: the initial enrollment period, the general enrollment period, or if you qualify for special enrollment period. So that's when you can get Medicare for the first time. But then the second bullet, once you have Medicare, you also might want to make changes to your coverage, right? You can't do that at any point in time during the year. The same thing applies. You have to wait for specific time periods to make those changes. And there's a yearly open enrollment period. There's a Medicare Advantage open enrollment period, a 5-star enrollment period, and also the special enrollment period if you qualify. So let's take a closer look at these enrollment periods. And let's start with the first, right? Initial. Your initial enrollment period, you'll hear this called the IEP, is really around the month of your 65th birthday. So it is a 7-month period in total. It's going to include the 3 months before you turn 65, the month of your birthday, and then the 3 months after you turn 65. And the important thing about the initial enrollment period is because it's your first opportunity to sign up, I mean, if you use this enrollment period to get Medicare, you aren't going to have late enrollment penalties, right? It's your first opportunity to sign up. You're taking advantage of that, and therefore you're not joining anything late. So you will not have any late enrollment penalties, if you use this enrollment period. Now, it's important to know, and you want to make sure, like if you're coming off of your retiring from work and your work coverage is going to stop on a certain date, you're going to want to make sure that you coordinate when your Medicare coverage is going to begin so that you don't have any gaps in coverage. So it's important to know that even if you're in your initial enrollment period, depending on what part of your initial enrollment period or which month of your initial enrollment period that you sign up, that's going to affect when your Medicare coverage is going to begin. So you can call Social Security well ahead of time and make sure that you can work it out so that you're joining in time to make sure that you don't have any gap in coverage. So if you sign up within the first 3 months of your initial enrollment period, or the 3 months before your 65th birthday, then your Medicare coverage is going to start on the first month of your birthday, right? Your birthday month. If you sign up within your birthday month, then your Medicare coverage is going to be effective on the first of the following month. And if you wait to those last 3 months to sign up for Medicare, then your Medicare coverage is going to be delayed those 2 to 3 months. So just keep that in mind, that not only do you have to know when your enrollment period is, but also when you sign up, what month of your enrollment period that you join can affect when your coverage start date is going to occur. And during this IEP, you can enroll in Part A and Part B. We talked about original Medicare. If you have both Part A and Part B, you can choose to get Medicare Advantage, which again, we'll talk about on day 2. And then if you have either Part A or Part B, you could also choose to get Part B, or prescription drug coverage. So you can make all those choices here within your initial enrollment period. And you can see there's an additional note about a Medigap open enrollment period. And that's a little bit different. We're going to go into that in detail a little bit later on the slides when we're covering our Medicare supplement insurance policy. So we'll cover that in just a moment. Now, if you already have Medicare, right, you've already signed up, what if I want to make a change? And that's what the open enrollment period is for, right? This happens every year. It starts on October 15th. It ends on December 7th. And this is for making changes that would take place or take effect, rather, on January 1st, so the new calendar year. So every month you have 7 full weeks to compare your Medicare choices and make changes because, you know, our health and situations in our life change. So we want to make sure that you have the opportunity to pick the coverage that's best and right for you and your situation. So during this time, you can join a Medicare Advantage plan, or if you're already in a Medicare Advantage plan, you can switch and change which plan you're in. You could change back to original Medicare, which, as Sylvia referred to, fee-for-service Medicare sometimes. And you could also choose to join, switch, or drop a Medicare drug plan or Part D plan. So it's really an annual time to review and make changes to your health and drug plan choices. There's not going to be any new late enrollment penalties if you're using this time because we're not enrolling for the first time, right? If we're using this, we're just making changes to how we get coverage. So there's no quote unquote new late enrollment penalties. Now, if you already had one, that doesn't go away either, right? This is just making changes to how you get your Medicare. Now, what if you missed your initial enrollment period, right? You just, for whatever reason, those 7 months came and went and you did not join Medicare, but you want it. Then you do have an opportunity to get Medicare every year. This is called the general enrollment period. So it starts on January 1st and it runs through March 31st. And this is for people who don't have Medicare, but they want to get it. Okay, so they, for whatever reason, missed their IEP. Now they can use the general enrollment period to join Part A. And that you can see the parenthesis says if you have to buy it, right? If you are entitled to free Part A, once you're Medicare eligible past age 65 or receiving disability benefits for 24 months, you can join free Part A anytime after your eligibility. You don't have to wait for an enrollment period. But if you have to buy Part A, then you do need to enroll during an enrollment period. So you can use the general enrollment period to get Part A and to get Part B. And if you get either Part A or Part B and you want drug coverage, then you can choose a drug coverage plan between April 1st or June 30th. And then if you want Medicare Advantage, you need to have both Part A and Part B. But again, you can sign up for your Medicare Advantage plan through April 1st through June 30th. So because of these additional options, you keep in mind that even though the general enrollment period is from January to March, right, and then you have April through June to make these additional decisions about Medicare Advantage or drug coverage, that means your coverage, your Medicare coverage is not going to begin until July 1st. So you can see where you might have a gap in coverage if you need health services and you don't have another source of health insurance. So just one thing to be aware of. And then you can see the red box on your screen. The important thing to note is if you're using the general enrollment period or GEP, it means you missed your initial enrollment period, right? You missed your initial opportunity to sign up for Medicare. So you might be looking at late enrollment penalties, right? If it's been at least 12 months that since you've had that initial opportunity, then you will probably be looking at a late enrollment penalty unless you apply for some type of, unless you meet the qualifications for a special enrollment period. We'll go into that in just a moment. All right, so the same time of year, so it's January 1st to March 31st, same calendar month, but it's a different enrollment period that applies specifically to those that have Medicare Advantage. So you have to be in a Medicare Advantage plan to use the Medicare Advantage open enrollment period. And this gives people the opportunity to switch Medicare Advantage plans with drug coverage, or they could switch to a Medicare Advantage plan without drug coverage. So they just have to really keep that in mind when they're making any changes to make sure that they're understanding the difference between the plans and which ones have drug coverage and which ones don't, right? Because getting Part D isn't guaranteed unless you were in a Medicare plan and Advantage plan on January 1st. with drug coverage, right? So if you go from a Medicare Advantage plan with drug coverage to one without, you cannot add a Part D plan, right? That's an important thing that people have to keep in mind when using this open enrollment period to make changes. Conversely, if you are leaving a Medicare Advantage plan to join original Medicare, you do get a coordinating Part D special enrollment period where you can add or drop Part D to switch plans. So you can use this time period, again, if you have Medicare Advantage, you can only use it one time. So it's not, you can't make a change in January and then change your mind and make a change in February to another plan. It's a one change opportunity from January 1st to March 31st to make some changes to your Medicare Advantage or revert back to original Medicare. And coverage for this, for your change, is going to be the first month after you contact the plan or Medicare to make that change. Now, you heard me refer to some special enrollment periods or SEPs. This is one we really want to highlight for you. Now, SEPs, as the name implies, only applies for special circumstances. So not everyone might meet the circumstances to use an SEP. But this one is specific for people who have group health plan coverage. You can see GHP through their active employment. Okay, so if you are still working when you become Medicare eligible, so maybe past age 65, and through your active employment, you're covered by your group health plan, you can choose to delay your Medicare enrollment, right, while you continue to working because you're already covered by your employer health plan. You can choose to delay your Medicare enrollment without fear of late enrollment penalties because of this SEP. So you get 8 months from when you retire or your GHP coverage ends to sign up for Medicare Part B. And as long as you use this 8 months, either while you're still working, you can sign up for Medicare, or within 8 months after your retirement or your coverage ends, you can enroll in Medicare Part B and you will not have to pay a late enrollment penalty. Now, it's important to note that this only works if you have group health plan coverage through active employment, right? COBRA, or Consolidated Omnibus Budget Reconciliation Act, retiree coverage, long-term workers compensation, and Veterans Affairs, or VA coverage. That's not considered active current employment, right? So that would not qualify you for this special enrollment period. It only works if you have coverage through your employer, through your active employment from a group health plan. So that's important to know for those that are past the age of 65, that they have this opportunity to delay getting their Medicare Part B and paying that monthly premium on top of their group health plan premium, and it lets you delay until you really need it and you're retired and your GHP coverage is ending. There are also other special enrollment periods, and here's a list of certain circumstances that may qualify you for a special enrollment period. So that first one is if you move out of your plan service area, and that really applies for people that have a Medicare Advantage plan, right? There's a specific service area. So a move would allow you to have an opportunity to enroll or change coverage. For those that have both Medicaid and Medicare, sometimes you'll hear people talk about duals or dual eligible. It means you qualify for both of these programs. And if that's the case, then you do have opportunities to make changes. If your plan leaves the Medicare program or reduces its service area, again, this really applies more to people who have Medicare Advantage, as their Medicare Advantage plans can dictate a specific service area by zip code or county, for example, or they can decide to no longer be part of the Medicare program. So certainly in those cases, you would get a special enrollment opportunity. If you leave or lose your current coverage, so your employer or union coverage, you might have an SEP. Any change in a status for a long-term care facility, like a nursing home. So whether you're going to a nursing home you live at, or you're leaving a long-term care facility, right? All of those situations, any change in that status would qualify you for special enrollment opportunities. The next is if you lose your extra help status. And so we haven't gone into this, but extra help is essentially a program that would help pay for Medicare drug coverage. Sometimes it's called low income subsidy. So there are certain income requirements that people look at and apply for to get extra help status. So if you lose this extra help status, then you get an opportunity to make change to your Medicare coverage or a special enrollment period. If you're sent a retroactive notice of Medicare entitlement, and then you can see there's other exceptional circumstances, and our notes in this slide can go into more specifics about the other special enrollment period circumstances. All right, so that's a lot of information. Let's take a moment to go through a check your knowledge and really kind of sort some of this out. All right. Your friend tells you he's looking forward to the yearly open enrollment period so he can sign up for Part B since he missed his initial enrollment period. What do you say to that? All right, so there's two answers on your screen. I'm going to start the timer. Say, great, you'll need to wait until the next general enrollment period, or two, that's a great plan. So when we talked about the open enrollment period, the initial enrollment period, and the general enrollment period, what do you guys remember about that? Go ahead. Yep. Perfect. Most of you guys got this, right? The open enrollment period that he's looking forward to, he can only make changes to his coverage, right? He can't sign up for the first time, right? That's the open enrollment period is just for making changes. The general enrollment period is for signing up if you missed your IEP. All right, now Sylvia is going to take us through the next portion.
All right, thanks so much, Kim. All right, let's go into automatic enrollment based on a disability. Now, we learned before that Medicare has two additional groups here. So if you're automatically enrolled into Medicare, you're under 65 and disabled, right? Or if you've been entitled to Social Security disability benefits for 24 months. Now, if you have ALS, Medicare begins the first month you're entitled to SSDI. But again, if you're under 65 and disabled, or people with end-stage renal disease who meet special Social Security earnings requirements, people with end-stage renal disease don't need to be entitled to Social Security benefits to qualify for Medicare. However, if they are also entitled to the disability benefits, they may qualify under both programs. And we'll talk more about end-stage renal disease in just a few minutes. But in most cases, you must be entitled to disability benefits for 24 months before Medicare can begin. And since there's a 5-month waiting period for SSDI, which is again the Social Security disability insurance, the earliest that Medicare can start is usually the 30th month after you become disabled. However, there are two exceptions. The first is the 5-month waiting period for cash benefits will not apply to people who get childhood disability benefits or to some people who were previously entitled to disability benefits in the past 5 years. That's one group. The second exception is the 24-month Medicare waiting period will not apply to people disabled by ALS, also known as Lou Gehrig's disease. People with ALS get Medicare the first month they're entitled to disability benefits. They do not necessarily have the 24 months to wait for Medicare entitlement. So again, this is automatic enrollment based on a disability. Now, the next slide, we'll talk more about Medicare enrollment under the end-stage renal disease. Now, when you're enrolling into Medicare based on ESRD, to enroll in Part A and Part B, you need to work with your doctor and get the Medicare form CMS 2728 to be filled out by the doctor at the dialysis center. And you will also need to enroll at your local Social Security office. So again, when enrolling into Medicare A and B, based on end-stage renal disease, you'll work with your local Social Security office. The Social Security will need your doctor to complete the form. And then at that point, then you may be asked to contact it and complete an application. Now, regardless of the number of employees or whether the coverage is based on current employment status, Medicare is the secondary payer of benefits for the first 30 months of Medicare eligibility. This is that 30-month coordination period for people with end-stage renal disease who have employer coverage or union group health plan coverage. Now, if your group health plan coverage will pay for most of your healthcare costs, for example, if you don't have a yearly deductible, you may want to delay enrolling into Medicare A and Part B until you get near to the end of that 30-month coordination period. If you delay enrollment, you won't have to pay the Part B premium for your coverage if you don't need it, because again, you might have some kind of group healthcare coverage. Now, after the 30-month coordination period, you should then enroll into Medicare Parts A and B. Now, if you'll soon be receiving a kidney transplant, to get facts about the eligibility and enrollment before you decide to delay, that could be based on a shorter time period based on whether or not you're going to be a transplant recipient. Social Security is an excellent resource for you, especially if you're looking to make an appointment to enroll into Medicare based on the end-stage renal disease. Now, the next slide here, we'll talk about Medicare choices for those with disabilities. Okay. Now, if you have a disability, you have the same Medicare health plan choices for those age 65 and older. You can do the Medicare Original Medicare route using the fee-for-service option. You can join a managed care plan. You can also look at Medicare Advantage or other Medicare health plans that might be available in your area. You have the option to join Medicare drug coverage, and you can either have that added on to your original Medicare, or you can join a Medicare Advantage plan with drug coverage. And if you have end-stage renal disease, you can now enroll into a Medicare Advantage plan or a Medicare Advantage plan with drug coverage. So there used to be some rules that were not allowing people with end-stage renal disease to enroll in a Medicare Advantage plan. Well, that has now ceased. And so then again, at that point now, everybody is eligible to join a Medicare Advantage plan. Now, most Medicare Advantage plans offer drug coverage, but again, you can always join a Medicare Advantage plan with drug coverage. What's interesting to note about this is, again, if you have Medicare based on disability, you get the same rights and protections as anybody who has original Medicare, Medicare Advantage, or qualifies for Medicare based on age. Again, you get the same coverage, and you may be eligible for extra benefits through a Medicare Advantage plan if that's your option, and you can get vision, hearing, and other dental services. So again, really the focus here is whether you qualify for Medicare based on disability or you age into Medicare, you get all of the same rights and protections, and you get all of the same choices as anybody. So again, you've got that option to do fee-for-service or managed care. Now, let's look here again at end-stage renal disease and look at this and looking at the coverage and the dates. Okay. All right. Typically, Medicare coverage will start on the first day of the fourth month of your regular course of dialysis. So again, the focus here is somebody who has end-stage renal disease. That's typically how Medicare coverage begins. Under that first month, if you participate in either home dialysis training program during the first 3 months of your regular course of dialysis, again, we know that your coverage will begin. The same month, though, you're admitted, your coverage will begin if you are admitted to any kind of Medicare certified hospital for a kidney transplant or for healthcare services that are needed before your transplant takes place. Again, your Medicare coverage will begin that same month. 2 months before the month your transplant is delayed, more than 2 months after you have been admitted to the hospital for the transplant or for the healthcare service you need before the transplant. So this chart is pretty clever because it kind of outlines when your Medicare coverage will begin. But again, look at the different circumstances that may be eligible. Now, if you're eligible for Medicare based on end-stage renal disease and you don't enroll right away, you could be eligible for up to 12 months of retroactive coverage once you've enrolled into the Medicare program. So really work with Social Security to figure out what the best time frame is when you're looking at that coordination period, or if you qualify, again, some of those claims can be submitted because it's retroactive coverage. So again, as you look at this chart, it's a great reference to know when your Medicare coverage will begin based on end-stage renal disease, whether you're getting a kidney transplant, if you're just getting dialysis, if you're doing home dialysis training, or again, if it's been delayed, your transplant delayed more than 2 months after you've been admitted to the hospital. All right, we've got another Medicare puzzle here. All right, let's look here. I know that we've been talking about enrollment periods, so what's this example of? Okay. I see a door. We know that enrollment is the role. Okay, the answer is open enrollment. Okay. All right, let's look here at the second one. What do we think this one is? It's pretty easy. All right, enrollment period. And this last Medicare puzzle, I like all these stars and confetti. What do you think that denotes? All right, special enrollment period. So again, Kim talked about the different scenarios of what you might be eligible for a special enrollment period. All right, Kim, you want to go ahead and finish up on Medigap?
Sure thing. Thank you so much, Sylvia. So just kind of a refresher where we're at in our day one. We just went through original Medicare, right? We did Part A, Part B. We talked about the coverages, the services and coverage and costs. We talked about how to enroll. Some are automatically enrolled, right? We've done all of that. So now we're going to take a closer dive into kind of our Medicare coverage choices. Like we have options in how we get our Medicare. And depending on which Medicare coverage choices you make, you might have options to get other supplemental coverage, right? So let's take a look at our lesson 2. And you really have, at first, 2 main ways that you can get Medicare, right? And we talked about those certain times of the year that you can enroll, and then when you can maybe make changes in how you get your Medicare. And what we've been focusing on for today is really that box on your screen to the left, original Medicare, right? We talked about Part A, Part B, kind of your fee-for-service, original Medicare, the red, white, and blue card. That's where we've been focusing on for most part for day one. And we talked about there is another option. You could choose to get a Medicare Advantage plan. But those are really your 2 main ways to get Medicare. Now, if you choose the original Medicare box, so let's pretend like we're zooming in here, let's look at what that includes or what choices original Medicare has, and what are some other options that you can add to that original Medicare side. Okay, so we know about Part A, there are inpatient services. We know about Part B, our outpatient preventive services and the labs and durable medical equipment, right? That's what we talk about with the original Medicare program. If you have either Part A or Part B, and you want to get prescription drug coverage, you can choose to add a Part D plan, right? And then we're going to go into those details on the day 2 training. But you can also add what they call supplemental coverage, right? And that's that last box on your chart. So if you have Part A or Part B, you know that you're going to have some out-of-pocket costs, right? We talked about your deductible. We've talked about there's co-insurance and co-pays depending on the length of your stay for Medicare Part A, or if you have Part B services, right? It's going to be 20% for the most part for your Part B covered services. So Medicare covers a lot, but it's not covering everything, and it's not covering everything at 100%. So there are out-of-pocket expenses if you have original Medicare. And you have to decide on what way you want to handle those out-of-pocket expenses. You know, what does that mean for your budget? Do you want to purchase maybe supplemental coverage? Or maybe you have a form of supplemental coverage, like from an employer or a union, right? If you don't have another form of insurance, what you can choose to do is to buy an additional form of insurance that's called Medicare Supplement Insurance, right? This is a Medigap policy, and it's designed specifically to work with original Medicare coverage, right? So if you want a Medigap policy, it's only designed to work and help with the cost for original Medicare. It's not going to work with a Medicare Advantage plan, or it's not going to help you with any costs from, you know, your group health plan coverage or your retiree coverage, right? It's only going to work with Medicare for a Medigap policy. And so what a Medigap policy is, it's sold by private insurance companies, and And it's designed to work with the original Medicare, right? It's going to fill in those gaps, what we call those out-of-pocket costs, and help you pay for the deductibles, the coinsurance, and copayments that are associated with the original Medicare, so Medicare Part A and Part B. Now, each Medigap policy or plan is standardized by a letter, and we'll have a chart in just a moment that'll show you all the different letters. But just want to give you that heads up, don't confuse a Medigap policy Plan A with Medicare Part A, right? They're two different things. They're just being standardized alphabetically. Okay. There's also Medigap policies that people can look at that might cover certain benefits that original Medicare doesn't cover. One good example of this is emergency foreign travel expenses. Medicare coverage is only going to work within the United States, generally, except for in some small emergency situations. But if somebody is maybe traveling a lot and they're interested in additional purchase, they might want to look at a Medigap policy to help them cover that. So because each Medigap policy is standardized, so a Plan A from one company is going to cover the exact same thing that a Plan A from another company is going to cover. The only change that might be between those two Plan A's is going to be the cost. So it's really important for people that are looking for a Medigap policy that they're comparing costs, because we know the coverage is going to be the same because it's standardized policy and all Plan A's are going to cover the same thing. And the only thing that might vary is the cost. So this applies for most states, but there are some waiver states you can see there on the bottom bullet there that we call Minnesota, Massachusetts, and Wisconsin. They manage their Medigap plans in a different way than the standard. So they wouldn't, the same things that we're going to go over in just a moment don't necessarily apply in most states. There are also things in some states that are called a Medicare Select. There are standardized plans that can require you to see certain providers, and so they may cost less than some other Medigap plans because you're limited to the providers that you can pick. So just kind of be aware of these different terms that you might hear as you're shopping for Medigap policies. There are some benefits that all Medigap policies are required to cover, and let's take a look at those now. If you get a standardized Medigap policy, it's got to cover these basic benefits, no matter what letter it is. And that's the coinsurance and hospital costs for Medicare Part A, the Part A hospice care or coinsurance copayment, blood, and that you see the first 3 points there. And then the Part B coinsurance or copayment, right? That's that 20%. So these are the basic benefits that all Medigap policies, regardless of the letter, are going to cover. When we talk about what Medigap policies cost, that can depend on several different factors. And so let's take a look at each of these factors one at a time. So what we're going to charge, again, we're going to be looking at a monthly premium, so an amount we're going to pay for this insurance, this additional insurance is going to help us pay for the gaps in Medicare. It depends if the company that we're buying the policy from is using what's called medical underwriting, right? Medical underwriting essentially means that they're reviewing your medical history and deciding whether or not to accept your application or add a waiting period for a pre-existing condition if your state allows it, or they may apply a different premium depending on what they're seeing in your medical history, right? That's all things that insurance companies can do in certain situations. Now, if you're enrolling during your Medigap open enrollment period, you might have what we call guaranteed issue rights. And we'll go into that in just a moment with your Medigap open enrollment period and some of the protections you have in getting the best cost for a Medigap policy. Your cost can depend on, is it a Medicare Select policy, right? We just mentioned that there are some Medicare Select policies that are limiting you to a specific set of providers. And if that's the case, the trade-off is the cost. So you're agreeing to see only the select few providers, and you're paying less for that policy than you would a standard Medigap policy. Are you in your Medigap open enrollment period, right? I just alluded to that. We're going to go into what that means in detail. But generally, if you're in your Medigap open enrollment period, that's the best time for you to shop for and buy a Medigap policy because you're going to have certain protections and you're going to generally pay the least amount, the lowest cost, if you're enrolling during your Medigap open enrollment period. It can depend on where you live, whether you have an urban or rural zip code, right? So companies have the right to adjust their policies based on these things. It can depend on how old you are. Like if you're older when you're buying the policy, which is sometimes called age-rated, or when you get older and attained age rate. So then companies can adjust what they're going to charge you for their premium based on your age. And this is in certain circumstances, assuming that you don't have these other protections that might apply. And then overall, we alluded to this when we first talked about it, it depends on the company, right? A plan A is going to be a plan A. It's going to cover the same things. It doesn't matter if you're getting it from company XYZ or company ABC. The only difference might be in cost, right? So it's really helpful when you're buying Medigap policies to make sure that you're looking and shopping around at the different companies that might be providing policies within your state. So let's take a look at what some of these standard policies are. So here's that chart I alluded to earlier. Now the first 4 rows, so under benefits, 1, 2, 3, 4, up to Part A hospice care, coinsurance, or copayment. Those are those basic benefits that we said all of the policies are going to cover, right? So that's why you see as you look across the chart that there's a percentage under policy A, B, C, D, F, G, K, L, M, N, right? They're all covering those 4 basic benefits because we've talked about those. Those are the required benefits that all Medigap policies have to cover. But you can see there's varying percentages and the portion that policy is going to cover that service for. Then as you move on, you can see that there are some plans that are going to cover the Part A deductible at 100%. If you move down the chart, when you get to Plan K, then that's going to cover it at 50%, and Plan L is going to cover it at 75%, and so on. So this is how you're reading that chart from left to right. Now, the next row down, the Part B deductible, it's important to know that the plans are no longer allowed to cover the Part B, 100% of the Part B deductible. So you can see it's covered by Plans C and F. So you can't get Plan C and F if you are newly eligible for Medicare on or after January 1st of 2020. Okay, so you can't buy them if you're new to Medicare. If you already had them before January 1st, 2020, as long as you're continuing to pay your premiums, you can keep those policies. So right, that's why they're still included on the chart. They're still out there. People still have them. You just can't get them if you're brand new to Medicare after January 1st, 2020. All right. So this is how we evaluate and compare which plans. We use that letter determination, and regardless of where, what company is selling a Plan C, it's going to cover at the same percentage rate, and the only difference is going to be that cost, right? What we're going to pay each month for it. And the cost we alluded to earlier is going to depend on when we sign up, right? Whether we're in our Medigap open enrollment period or not. And so let's take a closer look now at a video that really walks through when your Medigap open enrollment period starts and what are some of the protections that you get for buying a Medigap policy during this time.
The best time to buy Medicare supplement insurance or a Medigap policy is during your 6-month Medigap open enrollment period, or OEP. Your Medigap OEP begins automatically when you're 65 or older and enrolled in Medicare Part B. During your Medigap OEP, you have the right to buy any Medigap policy sold in your state for the best available price. There are other limited situations where you may be able to buy a Medigap policy, which is known as your guaranteed issue right. In most cases, you have a guaranteed issued right when you have certain types of other healthcare coverage that changes in some way, like when you lose the other healthcare coverage. When you have a guaranteed issue right, an insurance company must sell you a Medigap policy, must cover all your pre-existing health conditions, and can't charge you more for a Medigap policy because of past or present health problems. In most cases, you can buy the Medigap policy up to 60 days before, but no later than 63 days after your MA or PACE plan ends. The date on the notice you get telling you that your coverage is ending, or the date on a claim denial. You should keep any paperwork, emails, or claim denials that have your name on them as proof of your coverage being terminated to prove you qualify for a guaranteed issue right. Then you won't need to answer medical questions. Some states may provide additional Medigap rights, so be sure to talk to your state Department of Insurance or your local state health insurance assistance program, or SHIP. Here's Patricia. She's turning 65 and still working, and she is covered by her employer group health plan. She plans to enroll in Part A now and enroll in Part B later because she still has employer coverage. This allows Patricia to delay her Part B enrollment until her employer group health plan coverage ends or she retires, whichever comes first. She's not getting Social Security or Railroad Retirement Board benefits yet. Because Patricia is delaying her Part B coverage, the start of her Medigap OEP is delayed too. Remember, for her Medigap OEP to start, she must be both 65 or older and enrolled in Part B. Once Patricia enrolls in Part B, her Medigap OEP begins. She won't have a delay in her Medigap coverage as long as she buys a Medigap policy during her Medigap OEP, even if she has a pre-existing condition. This is because she kept employer-sponsored group health coverage while delaying Part B, with no break in coverage for more than 63 days. What happens if Patricia misses her Medigap OEP? Patricia may have other opportunities to buy a Medigap policy. However, her timing is critical. The insurance company can deny coverage or charge her more if she misses her Medigap OEP and she doesn't qualify for a guaranteed issue right, or her state doesn't have additional rights and protections. It's important for Patricia to understand that after her Medigap OEP ends, there's no guarantee that an insurance company will sell her a policy. Some states may have more generous rules. It's best that Patricia talks to her state insurance department or local state health insurance assistance program, also known as a SHIP, for more information about her Medigap OEP. If Patricia is able to keep her employer group health plan after she retires and the plan ends, she'll have a Medigap guaranteed issue right. She'll need to keep the notification that her coverage has ended to show that she has a guaranteed issue right to buy a Medigap policy. Generally, if she misses the time that her guaranteed issue right covers, she may still be able to buy a Medigap policy whenever an insurance company is willing to sell her one. However, the insurance company may charge her more and it may delay or deny coverage for pre-existing health conditions. When you talk to Patricia, make sure she understands why the timing of her Medigap OEP is important.
Okay, excellent. So I think that video does a really great job of walking through a scenario where somebody's continued to work past age 65, so they delayed their Part B, and by delaying Part B, they actually also delayed their Medigap open enrollment period, because your Medigap open enrollment period begins when you have both, you're 65 and you're enrolled in Part B. So let's just highlight a couple of the things that we learned from the video. Right, your Medigap open enrollment period has to last at federal minimum 6 months, right? But some states have more generous rules. So it could be longer in your state. And that's why, again, the video called out to double check with your state's Department of Insurance or your state health insurance assistance office, or SHIP. So during that time of a Medigap open enrollment period, you can only have one of them. You can't repeat it. You have these protections. And so generally you're going to get the best premium rate, the best price, and you won't have a delay or waiting period for existing conditions if you're purchasing a Medigap policy within your Medigap open enrollment period, within these 6 months, okay? So because you have these protections during your Medigap open enrollment period, companies can't refuse to sell you one. They can't make you wait, right, for a waiting period for a pre-existing condition. and they can't charge you more because of your past or present health problems, right? We talked about some of the costs that go into things. There's things like medical underwriting where they're looking at your previous health history. Like that doesn't apply if you're in your Medigap OEP. Okay, but if you miss your Medigap OEP and your state doesn't have additional protections, then you can still buy a Medigap policy. You just don't have those guarantees that a company is going to sell you one, right? They don't have to if you're outside that period and your state doesn't have more generous protections. But you can still get one. You just are probably going to have to pay a higher rate, and you might have some of these limitations like a waiting period or a pre-existing condition that they'll take into effect. So that's why it's really important to understand if you're looking at Medigap policies, and again, we talked about really you want to shop around because the only thing that's going to change from policy to policy is really the price. And if you're looking for the best price, then you want to make sure that you're shopping within your protected time period, that Medigap open enrollment period, where you are both 65 and have Part B. Now, in some states, if you get Medicare due to a disability, some states you might be able to buy a Medigap policy, right? Even though you haven't reached age 65, some states have that option that you could still get a Medigap policy even if you're under 65, but it's different in different states. So again, double check with your Department of Insurance specifically for the guidelines in your state. And with that, I think I'm going to turn it over to Sylvia for a Check Your Knowledge on Medigap policies. Sylvia?
All right, great job, Kim. All right, now let's get a Check Your Knowledge on Medigap policies. Let's look at the example here. The friendly representative on the phone tells you that you can't buy a Medigap policy from her company to supplement original Medicare because you have a Medicare due to disability and are not 65. Is she right or is she wrong? What do you think it is? You've got a few seconds here to get the answer. Well, the answer is it depends. And the reason why it depends is really about what state that you live in. Again, we talked about how Medicare oversees Medicare Advantage plans, but Medigap is really going to be administered and the major oversight is by the states. So federal law does not require insurance companies to sell Medigap policies to people under 65. If you're under 65, you might not be able to buy a policy in your state if you want. So again, you really need to check with your state requirements if they allow Medigap policies for those under the age of 65. All right, let's look at the next slide. We've got another Medicare puzzle here. What do you think this is? Kim's been talking about it this last few minutes. All right, I think I see some answers here. It's Medigap. Again, Medicare supplemental insurance policies, they just help fill in the gaps of what original Medicare does not pay for. All right, the next one here. What do you think this is? I see money. All right. You're typing in your answer here. It's copayment. Remember that, under original Medicare, Medicare typically pays 80%. You pay 20% for your claims. Medicare Advantage plans could set a copayment for any services that they have. So again, you'll know that if you choose a managed care plan through the Medicare Advantage plans. But again, the answer here for the Medicare puzzle is copayment. All right, this is an excellent resource for you, and I really encourage you to kind of take this as either as a job aid or just a great reference tool. It's a list of our acronyms. I know that we've talked quite a bit about ESRD, end-stage renal disease. Kim talked about the federal poverty levels. We've talked about group health plans. This is just a great list of acronyms that we've been referring to during this session, but again, it's also a great reference as you see in other materials because they don't always type it out. So now you know when someone says, I've got a moon, you know that it's the Medicare outpatient observation notice. All right. Let me direct it on over to our closing statement here. But as you can see, you can always stay connected through Medicare, looking at our CMS National Training Program. You can email us too at training@cms.hhs.
All right. Thank you so much, Sylvia. And thank you, Kim, for walking us through such helpful Medicare program information today. This concludes our presentation for day 1, but please join us for the Understanding Medicare Day 2 presentation tomorrow, where you can learn more about Medicare drug coverage and Medicare health plans like a Medicare Advantage, as well as information about coordination of benefits and preventing Medicare fraud, waste, and abuse. And as Sylvia mentioned, you can visit our website at cmsnationaltrainingprogram.cms.gov for more training opportunities, learning materials, and e-courses. And you can contact us or send your questions to training@cms.hhs.gov. Thank you again for joining us and enjoy the rest of your day.